Earlier people used to invest in gold and all. Nowadays people are investing into skin and hair care because they think that it increases their confidence when they go to a workplace or for any other thing.
It's not a crime to want to look youthful and good. It's not a crime at all. But sometimes it becomes an unhealthy obsession.
There are various kind of fillers which are available, which are like from plumping to lifting to just mild booster treatments. So for every kind of client there is a treatment. But if somebody has an unhealthy obsession, it's the doctor's responsibility to guide them, that do not overdo it. I get an equal number of men and women walking into the clinic. The 10 years prior to this, we didn't have so many men walking in, but nowadays the women are bringing in their men. What I would suggest is in your 30s, you should start with using collagen creams, hyaluronic acid creams, so that you don't age faster. I love injecting fillers. Like I myself, I had fillers on my face, but when people look at me and say, oh, I can't see fillers on your face. So I said, because I do the lifting fillers.
There's still a fairness bias in our society, right?
Of course, as you all know, Fair and Lovely always worked in our country. It has been there even before both of us were born, I think. Let's say you are in an aesthetic industry where your color matters or you're not getting married. Now, I have to say this, because a lot of people are coming because of marriage. They are doing it because they want to do it marriage or because of being accepted in a particular society. Glutathione, anything in excess can cause side effect, and I am not a huge promoter of glutathione IV therapy at all.
You're not?
I'm not.
Why?
No, because the thing is, it's something, when you're reducing, it reduces the melanin.
We see a lot of actresses around us, Bollywood actresses, and and people are speaking openly about how many of them have lost their expressions and the lips are looking too big. It's just looking, and everybody's looking alike.
So filler fatigue is like people have been using a certain kind of filler for years. They have been reputed brands which people have been using, but the whole problem about that particular brand of the filler, I wouldn't name that. What has happened is that it stays for years and years in the body.
Mirror, mirror on the wall, who is the fairest of them all? This famous line first appeared in the popular fairy tale Snow White, written in the year 1812. Ironically, this line is even more relevant in today's world, where the pressure to conform to unrealistic societal standards of beauty is immense. Even the skincare and beauty industry are capitalizing on this rush to look picture perfect, with new treatments and procedures being introduced every day. To weigh the pros and cons of cosmetic procedures and explore realistic approaches to embracing aging, we have with us leading dermatologist from Mumbai, Dr. Meghna Mour. Welcome on the show. Welcome on Buzz by the Bay, Doctor.
Thank you. Thank you for having me here.
Thank you. I know you have a very busy schedule and consults all the time. So, getting to the point, you're a well-known dermatologist. You have a lot of celebrity clients. These days, there's so many treatments for skin tightening, brightening, plumping, removing wrinkles. Is it now the new normal that everybody just does this, especially anyone who has a public persona?
Yeah, it is completely true. This industry is growing by leaps and bounds because anybody and everybody who's working, not working, wants to spend some time and invest on themselves in their skin care, hair care. So it's a buzzing thing. So a lot of people are buying online, a lot of people are into cosmetic industry. All this has happened post-COVID when there was a lot of boom in the e-commerce industry where they started offering all these various kind of creams and everything. And once a client starts using all these things, they get into the thing that, okay, it might make some difference. And then they start coming to a dermatologist, and which is the right approach. So yes, of course, and a lot of new things have entered the Indian market.
Are we seeing an unusual rise in, people doing these kind of treatments? Like, it's become so commonplace now.
Yeah. So absolutely, men, women, younger crowd, everybody is, going to these cosmetic clinics, dermatologist clinics, because it has become so important nowadays. Earlier, people used to invest in gold and all. Nowadays, people are investing into skin and hair care because they think that it increases their confidence when they go to a workplace or for any other thing. They like to be confident and they want to show that they are, they believe in their skin. Aging gracefully is also a very big thing.
Aging gracefully is a big thing, but then it's also important to draw that confidence somewhere from within also, not always rely on, external treatments, which is what I want to come to. Yes, of course, it's your life, you're free to do what you want, and it's not a crime to want to look youthful and good. It's not a crime at all. But sometimes it becomes an unhealthy obsession. Also, there's sometimes a risk because we have heard of certain procedures going wrong. One does read of procedures going wrong, and sometimes you can tell when a procedure has gone wrong because the person starts looking so fake, and then like even for actors and actresses, sometimes they lose their expressions because it's so heavily botoxed or so much filler, so many fillers have been put in. So I just want to come to what treatments are advisable, to what limit you should take it, and which are the safest treatments.
Okay. So coming to that point, first and foremost, you should go to a qualified aesthetic injector or a practitioner or a dermatologist who's qualified in the field. Now, as you see, there are a lot of people who are unqualified and they don't know what to use and how to use. And of course, if you go to a right person, a right dermatologist, they're going to guide you which treatment is good for you, how much is to be used, and at what intervals you can use. Now, when you see an unhealthy obsession, some people have that problem. They keep on going to the doctor, they keep on going to the aesthetic injector, and this is what we normally see on the, we see it on the internet and everything. They're showing all the big things and big things, but it's not so. 99% of the people are getting injected, and it's a very subtle way to do it. And if you go to a right injector, they will guide you. There are various kind of fillers which are available, which are like from plumping to lifting to just mild booster treatments. So for every kind of client, there is a treatment. But if somebody has an unhealthy obsession, it's the doctor's responsibility to guide them, that do not overdo it. But 99% of the clients coming to a clinic are not celebs. They are regular people. They're going out in the offices. They want to be presentable. They are on camera. A lot of people have become influencers. They are on the thing. So they want to feel confident.
So let's come first to anti-aging treatments. As women age, when they enter perimenopause, before they go into full menopause, estrogen reduces in the body, right? And that means the collagen is depleted. Collagen, if I'm not mistaken, is a structural protein in the body, and that the collagen gives you sort of structure, strength, support. According to you, which are the safest treatments for collagen boosting or skin tightening?
So I would like to correct you on that. So not only women, even men are losing collagen.
Okay, men also.
So I get an equal number of men and women walking into the clinic. The 10 years prior to this, we didn't have so many men walking in, but nowadays the women are bringing in their men to the clinic, and men are also super wanting to look younger and feel better, and because post 40 even they have that menopause kind of complex, the male menopause. So the collagen is decreasing in each and every human being. What I would suggest is in your 30s you should start with using collagen creams, hyaluronic acid creams, so that you don't age faster. Second thing is there are many different injectables available like skin boosters. Now skin boosters are also containing hyaluronic acid. Now hyaluronic acid is the basis of our cell structure which holds the cells properly. This hyaluronic acid, when you inject it into the skin, they do not play a role like a filler. They do not plump you, they do not lift you, but they boost the collagen. So when you give the hyaluronic acid, you have a nice glowy dewy feel. You have a plumpiness of the face, not a plump, but a healthy glow on your face, and it also boosts collagen. So when you keep on taking them regularly, like once or twice in a year, you can avoid aging and have aging in a very graceful way. And nobody look at you and say, oh, look what you have done, look how you're looking, you cannot move your lips. So there are many biostimulators or collagen injections which are available. The commonly known name are Vital, Profilo, Skin Vibe. So these are commonly done by dermatologists all over the world, and India is doing it well.
Can you explain what is this substance exactly?
So basically when you say, you can imagine two bricks, we put a cement in between. Hyaluronic acid is that cement in between the skin cells.
Okay.
So basically what happens, hyaluronic acid bonds the two skin cells, and depending on that they attract water and they cause plumpiness. When you can think about an apple which is dried, you keep it out in the sun, it's dried. The moment it is fresh, it's dewy. When what is plumped into it, it becomes fresh and dewy. So similarly hyaluronic acid. So as you age, hyaluronic acid production decreases, but there are a lot of procedures. Okay, so our clinic has a lot of machines, something like an Exosomes RF, which are monopolar RF, which increases hyaluronic acid from within by 224%. You do not need to undergo the injection also. Other thing is you can start intake of collagens also, oral collagen, marine collagens. They are very good.
The powders that
the
you
powders and all. So it does work. It does work. So you have to take it for some time, then take a break, then again take it for some time. It helps in collagen building.
So you have a machine, you're saying, that generates collagen within you.
Yes.
So you don't have to inject it.
Yes, yes.
And is that safe? All these procedures are
So
safe?
this is US FDA approved. It's not invasive. It's like you apply gel and you move a machine, and it can be done all over the body, because a lot of people are into weight loss and they're getting crinkly skin on the neck, on the back, on the bums, anywhere. It can be done anywhere.
So it helps with weight loss also?
Yes, there are modalities in it. You don't necessarily want to lose weight on your face, but we go on a certain way, and a lot of people have wrinkling on the face, the neck, arms. They can do it. So if you want to have an added weight loss, we add the weight loss. We can moderate that whole procedure.
So basically, I guess, because as collagen depletes, I mean, I'm sure like women also start gaining weight faster. Is that what it is?
Yes.
Yeah.
Earlier I used to practice only skin. Now I'm practicing skin, I'm practicing hair, I'm practicing inch loss and body contouring. Very, very big segment.
Very interesting, the kind of treatments you're telling me about, generating collagen internally, then these skin boosters, exosomes. What is exactly exosomes?
So basically exosomes are the cells which are the potent stem cells, what we call. They are the ones which help in triggering the cell growth.
Okay.
Okay, but they are very safe. They are moderated in such a way that do not cause the unwanted cell growth. So exosomes are used on the face for skin regeneration. It is used for healing also. It is used on the scalp for the hair regeneration. So there are different kind of exosomes available. They are available in the liquid form. There are plant-based exosomes. So when somebody goes to a doctor, say, okay doc, I want to do an exosome. So basically they are the cells. Now when it's derived from the plant, they are plant exosomes. When it's derived from the human bone marrow, it's called as a mesenchymal or the human exosomes. Of course we are humans, so human exosomes or the mesenchymal exosomes are going to work better on you. Plant exosomes is for people who do not want to use anything from a fellow human being or something like that, but they are produced by the proper stem cell laboratories with proper US FDA approvals, and of course because they mimic our cells, they do better results. So the better the exosomes, of course it's going to be priced differently. So you should connect and go to a dermatologist who will give you a proper explanation what they are giving, how they are giving, and how it can be used. So of course the new thing, the latest buzz in 2025 is not to do too much of fillers or anything, or rather go into exosome treatments or go into the booster treatments. So exosomes can be given non-invasively with the help of a derma roller or something.
Derma roller.
It can be applied topically. So if you want no pain but you want results at the same time, you can go in for exosomes.
So it generates hair growth also. It can do that.
Of course,
that
I
also.
have everyday clients walking in for that every day.
So I want to come to a couple of things. One is you spoke about fillers, and I know there's this concept now, filler fatigue, all right, that we're seeing in 2025. What is filler fatigue? Because I just want to take an example actually first. We see a lot of actresses around us, Bollywood actresses, and and people are speaking openly about how many of them have lost their expressions and the lips are looking too big. It's just looking, and everybody is looking alike. I mean, recently, to take an example, because it's been in the news a lot, people are talking about the show The Royals, and they're talking about an actress, Bhumi Pednekar. Now, film critics are saying that an actress who was so natural, which had beautiful expressions and was such a good actor, has lost her expressions because the lips and all are looking too big. So is that filler, is that part of this, are those fillers? I mean, and what is this filler fatigue?
So filler fatigue is like people have been using a certain kind of filler for years. They have been reputed brands which people have been using, but the whole problem about that particular brand of the filler, I wouldn't name that. What has happened is that it stays for years and years in the body. You don't want anything to stay for years in the body. Something which you should be able to take out or dissolve it should be the norm. Internationally there are permanent fillers we are not using here, but there are still the semi-permanent fillers which stay in your body. So people have got sick and tired of that thing, and they're like, we don't like this thing. But I particularly use a US FDA approved fillers and certain range of fillers which do not stay for a long time. Of course, they don't last as long as the earlier fillers which was there, but of course you're happy that you can go back to your normal self. So it's the duty of the doctor, and it's a consented acknowledgement of the treatment between the client and the doctor that this will work for you, this will not work for you. You know, you need to have some expressions. We do not need to give you something hard. So there are many varieties of fillers available, from hard to soft to mobile, you know. Many of the celebs are coming to me and they say, we don't know what was used. I said, you should ask. I love injecting fillers. Like I myself, I had fillers on my face, but when people look at me and say, oh, I can't see fillers on your face. So I said, because I do the lifting fillers. I don't want the volumizing one. But if somebody comes and say, look, I want this picture. So there are a lot of people who come and say, I want lips this big. Then the injector will put. Then the doctor is not to be blamed. So sometimes I have lost few clients also when I've tried to say no. It's a call as a doctor. Of course, my managers would not agree with me. I've had incidents like that. But, you know, I would say as a doctor, I'm not going to take that call. You know, I'm going to say no to them. So, of course, it depends on the doctor and injector. But the client need to be aware that what have you used and how it has worked. So, I always tell my clients it's a journey.
Okay, so it's a journey, and you have told clients sometimes that, look, you look too plastic if you do all this, and you say that you, even at the risk of losing clients,
which I have.
You have said that. No, but that's good, right? Because you are a doctor. It is your responsibility to tell someone. You know, I'm just saying it is your responsibility to tell someone, because it becomes an unhealthy obsession. And I want to come to this point of young women doing it. We see a lot of young people doing it. Now, why would a girl in her 20s do like boosters and fillers? I'm just saying, because doesn't she already have, or even a guy and girl, don't they already have adequate collagen in the skin at that age?
So the thing is, it's not only about collagen boosting. A lot of people are quite like flat on the face. They need a little cheek, they need a little contour. So, you know, we have young people who are too much into health conscious, but they're absolutely flat. They do not have a glow. Now, you understand, when you are plumpy, when you have a little fat in your body, you start glowing and everything. The moment you lose weight and your skin is very thin and everything, you lose that glow on your face. People say, I lost the weight, but I lost the charm on my face.
Yeah.
So, in those cases, the boosters work very well. In fact, I do it for a lot of brides also, because they want that glow. They do one session. It lasts for 1.5 to 2-3 months, depending on the booster that have been used, and it's a perfect thing because they're not altering her face. We're just giving her a glow.
Okay, so it's not only about collagen. Sometimes it's about contouring, and it's about, you know, having a bit of that lift and
lift. So girls do like it, and they do it.
Fine, but you know, when we were growing up, at least all these options weren't available. I'm saying, but people look natural and they look nice, you know. But I suppose times also change. Coming to the cost, they're expensive. Like, how much is a skin booster or an exosome treatment?
So again, as I told you, exosomes are plant-based, mesenchymal, and from what the raw source you have got. So you have Chinese to American to everything. So prices change, and anywhere between 8,500 to 25,000 is the cost for the exosome. Even same as with the skin boosters. Normally anywhere between 15 to 25,000 is the cost of the skin boosters, because they give you an effect, and the more you use, then of course the doctor, you know, gives you a comprehensive plan. But it's a good way to do it.
And fillers, like let's say one filler shot is.
That depends on the brand.
It depends on the brand.
Yeah, they're long lasting. So
starting at?
It starts with 25,000 onwards. But of course, I would say in the fillers, more than the filler, it's the doctor who counts, because it's an art. Because anybody can hold an injection, but to give it nicely without bruising and understanding the correct way and where to be given is an art, and it takes years.
Of course, it's an art. I mean, come on, you're dealing with injections and face contouring. If it goes wrong, someone look like a clown. I mean, of course, and we've seen bad effects of it, you know. I mean, we've seen it happening to public personalities. But you know, these treatments are expensive. Everybody can't afford it. Some people would like to do it, but they cannot afford it, right? I mean, 25,000 a shot and all is not so easy for the average working person. So for them, what would you say? Would you say like collagen creams, hyaluronic acid creams actually are effective, or can be, or face yoga, things like that?
See, all these things are good if you start in your early 30s or in 20s, but once you develop the wrinkle, you have to iron it out. Only Botox works. And once you have the wrinkling, we can say that of course it will bring the hydration, but it's not going to give you that whole, it cannot be negated, this versus this. It cannot be done. And trust me, when a client has that inclination in the mind that I need to do something about it, they do come to the clinic and they do it.
Okay.
So there is a 99% chance that they'll end up doing it because they're conscious about it. And as I said it earlier, people used to invest in this, that, gold. Now they are spending on themselves. That why should I not look good? So people are spending on clothes, people are spending on looking good. So that looking good part, the fitness part. So the mantra is looking good, feeling good, health, mind, body, everything. People are looking into it, so they are doing what they feel right. So people are affording, and I have got like really average people coming and doing things with me, like breast lifts and everything. Lot of butt lifts are happening, lot of breast lifts are happening.
All these Brazilian butt lifts and things
Yeah,
like
not that far, but they're like, we need it, and the breast lifts, and very average looking people and coming like, we need a breast lift.
Wow, this industry is absolutely burgeoning. It's skyrocketing. And in fact, that you said that if they want to do it, they'll find a way to do it, even if they have to break their FD or sell gold. I'm just saying, people will find a way.
Yeah, people are doing it.
But then it also, like I said, it's totally a individual call, and there's no crime in wanting to look the best you possibly can.
Yes,
but
yes.
it's also the responsibility of doctors and influencers to say that, hey, there's got to be some sort of limit, maybe. I mean, there are unrealistic standards of beauty in this world, and you can't take Instagram that seriously. I mean, that everybody can't look a certain way.
The more you keep on seeing something, it does affect you. When everybody around you is looking good, feeling good, you feel that. But the people have now come to know that a lot of filters are being used, a lot of things are doing. So they do the groundwork, they do their homework. They come for a consultation so that they understand what and how it can be done.
Coming to another very talked about treatment, glutathione. It brightens your skin. It's an antioxidant, but many people take these glutathione IV drips to look fairer. And you can see a difference in many people. They look many shades fairer. Do a lot of people come in for this? And there's still a fairness bias in our society, right?
Of course, as you all know, Fair and Lovely always worked in our country. It has been there even before both of us were born, I think. So Fair and Lovely cream was working for ages, so everybody wanted to look fairer. And except for the European and the American, I think the whole world wants to look fairer than what they are. So it's a big industry all over the world. So why blame only India? Of course, we are having the buying capacity. India is a younger generation, so they are more into it and they are not ashamed to talk about it loudly. So glutathione, of course, people are taking it because it's an antioxidant, it's a vitamin, and the beauty about this antioxidant, if the body doesn't require it, it throws it out of the system. It doesn't like store it. So it's a very good vitamin. And of course, if somebody is looking for fairness, making your tone down, your skin tone down, of course you can take it. But of course, I would advise that you take certain sessions, then take a break. Take a session and then take some break. So that works well for you.
What about oral glutathione?
So oral glutathione is available at 600 mg and all, but the thing is it doesn't get absorbed so easily.
But side effects, I've heard there are side effects. In fact, a recent study shows that whereas glutathione is a strong antioxidant and it plays a complex role in cancer cell survival, but it detoxifies harmful substances, like carcinogens. But on the other hand, it can also, they say in some cases, it can reduce the effectiveness of chemotherapy and other treatments. So you have to be careful of these things.
No, so glutathione, anything in excess can cause side effect, and I am not a huge promoter of glutathione IV therapy at all.
You're not?
I'm not.
Why?
No, because the thing is, it's something, when you're it reduces the melanin in your body and everything.
Yeah.
You cannot take it for long, so you can get early graying of hair. Okay, so a lot of people are graying very, very early because it's reducing melanin all over your body. So, I wouldn't want to give it to my kids. So, let's say you are in an aesthetic industry where your color matters or you're not getting married. Now, I have to say this, because a lot of people are coming because of marriage. They are doing it because they want to do it marriage or because of being accepted in a particular society. If that is playing a psychological impact on you, then you should be taking it. But only because everybody is taking it, you should be taking it. No. So you achieved this thing, and then I feel you should be confident in the color you have. There are a lot of other treatments which are available, which you can apply topically, which does not have side effects, like the pigmentation laser. I've done a reel on that. There's a pigmentation laser. There are detan treatments and all, which are not going to go and do any harmful effect. At the same time, you can take tablets, which are not as high. But then, of course, celebs are different caste and creed only, because the whole thing, you know, is on that. You know, they have to look fairer and better and whatever.
Yes, you said many interesting things. I mean, you're saying celebs are different caste and creed. They have, but why? Again, why this fairness obsession? We are Indians. We are brown skin. I mean, okay, that's a whole different conversation altogether. But again, I mean, do you ever tell clients that, okay, I mean, there's no need to look like Snow White, you know? I mean, that there's, you said you're not such a big fan of glutathione drips. It reduces, so how it works is it detoxifies the body and it reduces the melanin.
It reduces the melanin in your
which
body.
is a pigment, right?
Yeah. So when somebody comes looking for it and asking for it, I don't say no. But I am not the first person to tell you, okay, go on that trip.
Okay.
I think most important is to have a clear complexion. Even if you're fair and you have all the pimples coming out and you know the red spots and your flaky skin and all, that would look weird, you know. So better to have a clearer complexion which shines through even if you're darker tone.
Yeah, absolutely. I mean, I don't think, I think we should now move beyond this like dark fair comparison. As a society, we've got to move beyond it, because, you know, our goddesses, if you look at our Indian goddesses, you have goddesses like Kali also. I mean, dark is not supposed to be interpreted as not beautiful. Dark is also beautiful, but that's, like I said, that's a whole
different conversation. So as I said, if somebody is looking for it, and then we are there to give it, and everybody is giving it.
Yeah, but as a society, one has to move beyond that bias. But like you said, it's more important to have clear skin.
Yes.
That's
very important.
So you have a lot of treatments for acne also.
Yes, we have a lot of treatments for freckles, for acne and everything. So when you have acne, I treat it like, you know, hardcore dermatologist. You know, we look into the diet habits, we are looking into your hormonal issues, and then we treat it for it, so that, you know, you have a near complete resolution of the acne treatment. Because if you don't treat acne, you're going to get acne all your life. You're going to get acne scars, and that, you know, works against your confidence.
Yeah.
You know, so clearer complexion always works better. So then that's a treatable thing, and it's a dermat preview. It's not a cosmetic thing. Yes.
It's your diet, it's your sleep, it's so many different things.
So many different things.
Yeah, you can't, it's not just about some cosmetic procedure.
No.
So I want to come to a last question, is on basic skincare. You know, for those who don't want to go in for all these treatments, what are, especially for our Indian climate, let's say Mumbai, what are certain non-negotiables in your daily skincare routine that you absolutely must introduce?
Okay, so skincare routine, obviously it depends first of all on your skin type. So you have to find out whether your skin is normal, dry, combination skin, and absolutely oily skin. So that categorizes the whole thing. So what you are using and what your friend is using or your mother is using may be completely different for you. So what you need is a good cleanser. So a cleanser for oily skin, you will use an oily cleanser. For a dry skin, you use for a dry skin. For combination one, use a combination. You'll use a normal cleanser. Along with that, you'll use a toner for the T-zone. Okay, so a toner dry skin should never use. But if you have an oily skin, let's say you have a teenage kid at your home and he's breaking out into acne, a lot of people come to consultation for us. We say, okay, use a gentle cleanser. Use a good toner, alcohol-free toner at night on the T-zone. And if an anti-acne cream is required, you use that. You should use a moisturizer. Now again, the moisturizer depends on the kind of skin, you know. So if your skin is very dry, a light moisturizer will be absorbed very fast. So you have to use something with collagen or hyaluronic acid for an aging skin type. If you're an oily skin type, you have to use a basic moisturizer which has more moisture or the water content in it. If it's a combination skin, again you can use that, and there are many moisturizers for sensitive skin type also. So if your skin is sensitive, you come to know, okay, this is good. So in a Bombay weather, there's a lot of humidity. So if you use a very thick moisturizer, let's say like Nivea or something, it's going to clog you completely. But the same person goes to Switzerland, you'll end up using Nivea, because you know the weather makes a whole lot of difference. Your skin, basic skin type makes a lot of difference. So you have to use a good cleanser, you have to use a good moisturizer, you have to use a good sunscreen. So these are three important things we tell you. Just identify your skin type or go to a dermatologist to help you identify your skin type. Then use the routine And if you're comfortable, don't succumb to the pressure of the e-commerce brands and say, okay, now I use this brand, now let me see use this brand. You are comfortable with the brand, which is like by a proper pharma industry, where they have spent a lot of money into the research and all. So if you see certain brands like Cetaphil, CeraVe and all, they have spent a lot of money on research.
Right.
Something new has come up. We don't know what research has happened. It's just marketed well. You have good products. You are comfortable. Carry them with you wherever you're going in the world. So your skin will get used to it, and they will not break out. You will not have breakouts. And as you grow with every decade, you keep on adding the additives. You have pigmentation, you'll add niacinamide. You want a glow, you'll add vitamin C. Now you want it's aging, you'll add collagen, hyaluronic acid. So these are additives. So basic skincare will remain the same. I would always tell everyone, carry. You're comfortable with that sunscreen. You're liking that sunscreen. You
What
go ahead
SPF
with it.
should it be?
So at least 50 SPF
At
is
least.
required. Yeah, because what happens is, you have to understand sunscreen, whatever you apply doesn't go completely into your skin. Only 40-50% will work, because it's a chemical reaction and there's a physical block. You have to apply 20 minutes before you go out in the sun, and you have to apply it nicely and apply it every 3 to 4 hours. So a sunscreen is very, very essential, because first of all, when you use a sunscreen, you're not going to get pigmented. You're not going to lose you'll not wrinkle faster, because you'll not lose the hydration, and it protects your skin. So it's antioxidant also.
Yeah. Okay, so sunscreen is one of the most important things, and as you said, it depends on whether you have dry skin or whether you have oily skin, but the usual, cleanser, toner, moisturizer, sunscreen being extremely important, and as you age, creams with collagen and hyaluronic acid.
Niacinamide. So everybody is buying all these things on products. So they come with a whole lot of things and say, doc, we bought all these things. Now what do we do about that? So you have pigmentation issues. You're getting the freckles, your pigmentation due to acne and everything. You can add niacinamide and vitamin C in the morning. And usually collagen and hyaluronic acid, we tell them to apply in the evening, because they're heavier. So you just apply them and go off to sleep. That's why they're the night cream or the sleep mask, and everything we do that way.
Okay. Well, thank you so much. This has been a very fascinating conversation, and one that can go on, and we will have you back to talk on a whole range of other things. Thank you, Dr.
Thank you
Meghna,
so
for
much.
joining us.
Thank you for having me here.
Thank you.
Yeah.